I am Dr. S K Gupta, Senior Specialist in Orthopedics and working as a Senior Specialist at Sekhar Hospital, Lucknow. Along with that, I am also heading and professor in orthopedics at Hind Institutes of Medical Sciences in Varabanki, Lucknow. So today I want to speak on some important topic that is the education for active life. We will give important tips in that and try to cover most of the aspect of the musculoskeletal health, how to stay fit. So now coming first of all to the importance of musculoskeletal health. Musculoskeletal health plays a key role to keep up the good mobility and dexterity in individual, along with enhancing their ability to work and actively participate in all aspects of the life. So even the layman understands how the importance lies with the good musculoskeletal health. Good musculoskeletal health is also crucial to maintain economic, social, functional independence, and throughout their life, it has got the same significance. Now, the physical activity, which has a crucial role in reducing the risk of other non-communicable diseases, and it can only be achieved with adequate musculoskeletal health. I mean to say that non-communicable diseases such as diabetes mellitus or the hypertension or the many endocrinal disorders. Now, what is the relationship between the painful musculoskeletal conditions and the reduced capacity to engage in the physical activity? Let us go in depth into this topic. Impaired musculoskeletal health can lead to acute and chronic pain, causing the physical limitation, proceeding in loss of participation and withdrawal from the usual social, community, or the occupational activity, further decreasing the quality of life. QOL. Now it is a very common term for the quality of life and the well-being, inclusive of the mental well-being. Impaired musculoskeletal health can lead to substantial personal, community, or the social consequences, particularly in the elderly persons. So, a strong relationship between painful musculoskeletal conditions, lack of physical activity, and resulting in the functional decline, fragility, loss of the well-being, and loss of independence. All these terms are somehow interrelated to each other, as well as the depression and some sort of the anxiety disorders may also be described along with these. Several epidemiological studies they have also said regarding this aspect. An individual with arthritis, I mean to say the inflammation of the joints and the musculoskeletal disorders is sure to be lesser active than an individual without arthritis. Everybody can understand this thing. Thus, a lack of regular physical activity emerges as the most prevalent risk factor associated with the functional decline. Most importantly, impaired musculoskeletal health causing the reduced physical capability like grip strength, grip in the hand, walking speed, chair rising, standing balance, so on and so forth, frequently linked to increased morbidity and mortality. This weak musculoskeletal health is a key component of the fragility. Now let us put few words. What is the impact of impaired musculoskeletal health? So this is more important to understand. The impact of impaired musculoskeletal health is now recognized globally, with an increase in the morbidity and later on leading even the morbidity. Good musculoskeletal health is crucial for maintaining an active, productive, and prolonged working life. With an increase in the global retirement age, as it is visible in India also, maintaining the good musculoskeletal health and become increasingly important for older workers, as many occupation and work-related activities are associated with musculoskeletal disorders like low back ache, very common, or shoulder disorders, or the knee problems, Thus, it is important to identify and implement effective interventions for people with musculoskeletal conditions to remain productive throughout their life at workplace. Now, high-income countries observe musculoskeletal conditions to be one of the major causes of work loss, early retirement, and most lost their retirement wealth, while developing countries see musculoskeletal conditions to have a major impact on the livelihood. Thus, reduced musculoskeletal health results in reduced productivity and economic loss to society, and even on the individual levels, this is in loss. Since musculoskeletal conditions are chronic, painful, associated with disability and social disengagement, frequently causes mental health impairment also, such as depression, anxiety-related conditions, physical and mental aspect of the QOL, quality of life, related to the health is known to be greatly impacted by the person with multimorbidity. Unfortunately, this impact is even greater when there is associated musculoskeletal disorders. Now let us see some aspect of the what is the burden of such diseases related to the musculoskeletal disorders. Now, non-communicable diseases, in short form NCDs, now account for most of the global burden of the disease associated with the musculoskeletal conditions. This being the leading contributor for such a problem. Developed countries as well recognize the transition of burden to long-term disabling conditions. However, now low and middle income countries are also demonstrating the enormous future impact from such musculoskeletal conditions such as osteoporosis, low back pain, driven by population growth and aging. So all these conditions are interrelated, I mean to say, the musculoskeletal disorders and non-communicable diseases. Now these are the global problems, not only in the developed countries, but also in the lower and middle income group of the country. Since age is the commonest risk factor for musculoskeletal conditions, as everybody understands, with aging, the musculoskeletal health becomes poorer. It is estimated by 2050, there will be a 5 times rise in the people over 40 years living in developing countries, contrasting the wealthier countries. This is the report of the World Bank, 2011. Additionally, obesity, another important risk factor for many musculoskeletal disorders. Age with the obesity, arthritic conditions, they worsen. Age with the obesity, osteoporosis worsen. And age with the obesity, other musculoskeletal disorders, they also worsen. So musculoskeletal conditions, this is the hypothesized to rise dramatically in the developing world also over the coming 2 or 3 decades. Furthermore, increased use of motor vehicles is not only reducing physical activity, but also increasing the numbers of motor vehicle accidents and resulting in the trauma-related musculoskeletal disorders. So all these conditions, again, the problems comes on the core problems becomes the musculoskeletal disorders. Now, what is the role of the physical inactivity and sedentary behavior in musculoskeletal health? So if we focus a light on all these conditions, then we see that the sustained and systemic urbanization in the developing countries. Urbanization, more use of the motor vehicles, less activity, and again sedentary life. This lead to sedentary behavior among the people, particularly the younger ones. They are not doing exercises, they are not exposed to physical activities. Rapid growth of the regions of the video games among the younger children, social media and movie streaming and binge watching seems to be the prime contributor. The sedentary life, they are somehow or the other related to these problems related to watching the TV or on the mobiles or various media they focus. This surge in sedentary behavior is not only a major risk factor for many chronic diseases, this is also recognized as substantial global economic burden. Increasing physical activity and optimizing exercise is recommended by arthritis research in UK or versus the arthritis or World Health Organization is an optimal way to improve the musculoskeletal disorder. I mean to say, if people live the sedentary life, such type of the behavior, and they go for the exercises and other health-related favorable conditions in the society, then the problems somehow this may come down. Evidence shows that the effects of a sedentary lifestyle, that is the desk job like, can be reduced by a small amount of activity every day. A recent meta-analysis utilizing the data of more than 1 million individuals, this is what they concluded, that 1 hour of the moderate level activity daily can eliminate the increased risk of death associated with the 8 hours of the sitting or the sedentary life. I mean to say, every day, at least 1 hour of the exercise or the physical activity. This is very essential for everybody to have the good physical musculoskeletal health and the good functional health. Now, thus a moderate level of physical activity remains a key requirement for healthy aging and maintaining the musculoskeletal conditions. Now, sedentary behavior is a major contributor to obesity and type 2 diabetes mellitus. Type 2, I mean to say, is diabetes mellitus in the adults. Likewise, obesity is also a major contributor for the development, progression, and ultimately leading to disability related to the osteoarthritis, particularly of the knee joint or the hip joint. With several epidemiological studies, they have confirmed this link between the adiposity, I mean obesity, and joint degeneration. Evidence also suggests that increasing the levels of the physical activity will not only increase the musculoskeletal good health, but also decreases the risk of suffering from obesity-related varied diseases like the diabetes or the hypertension or the thyroid-related disorders. Now, the WHO recommendations on physical activity for the healthy individuals. What is their recommendation? Let us put a small look upon that. Nearly what WHO suggests, nearly 2 hours per week of the moderate physical activity, or about 20 minutes per day, any kind of the physical activity, like the brisk walking is recommended by WHO. That is the a minimum. This recommendation is basically for the sedentary people who do not exercise at all. Otherwise, this 20 minutes is, they say, so somehow the other they develop the habit of physical exercises to have a good musculoskeletal health. These exercises elevate heart rate and are known to be associated with lower lifetime risk of the cardiovascular. So this exercise not only improves the musculoskeletal health, they say they improve even the cardiovascular health. Apart from rendering the musculoskeletal health benefits, improvement in the cardiorespiratory fitness can be achieved by changing sedentary behavior to active life and low intensity physical activity like walking or the doing some smaller exercises for the joints. Exercise is now widely prescribed for the rehabilitation of the musculoskeletal injuries also. And its use as a preventive health measures is now widely investigated with the guidelines around the type, frequency, duration of activity being considered. So even the trauma-related conditions of the musculoskeletal disorders or the degenerative conditions like the arthritis or the aging and obesity, all these interrelated problems can be solved to some extent by the physical activity and exercise. Now coming the focus on the evidence-based interventions for the musculoskeletal conditions that cause the most disability-adjusted life years. So let us see what is the evidence. Now, the low back pain and neck pain can be benefited by staying active and exercising regularly. So now most of us now understands how it is pertinent and important to do daily the exercise for the spine and neck for the alleviation of the low back pain or the cervical related problems. Group exercise programs or the weight loss support if required for the obese persons, this can also be considered with this. To reduce the incidence of falls, balance and strength training, particularly this is for the aging persons, they are prone to fall and leading to the osteoporotic fractures due to weak bones. Home hazard assessment, participation in falls prevention program, and getting involved in activities like gardening, dancing, etc. Osteoarthritis has been shown to be benefited from activities and exercise that improve muscles and aerobic fitness like walking, swimming, weight loss support that can be rendered if required. I mean to say, all these activities which the person can do, younger people can take the participation in aerobics or the dance related, or the most people they would do who know the swimming, cycling, or they can do and can be benefited for these musculoskeletal disorders. Now the aging is inescapable. Now this is the explanation, the association between the healthy aging and physical exercise related disorders. Aging is inescapable, but it can be made easy and healthy with the help of exercise. So aging persons, it is very necessary they should understand this. Exercise renders many benefits to the aging body, including the reducing of the manifestation of the aging, especially the aging phenotype of the elderly. A recent systemic review concluded physical exercise renders a positive impact on the muscle mass and function in the healthy subjects aged 60 and above by improving the muscular coordination and performance by increasing the ratio of type 1 to type 2 muscle fibers and increasing the cross-sectional area of the type 2 muscle fibers. I mean to say that this is pertinent for the senior citizens, people 60 and above, that they can lead a very healthy musculoskeletal health life. A European Society for Clinical and Economic Aspect of the Osteoporosis, Osteoarthritis and Musculoskeletal Diseases, it is in short term called SCO, ESCO, task force recommended higher protein intake in combination with the physical exercise in postmenopausal women at risk of developing a menopause associated musculoskeletal disease like the osteoporosis. Postmenopausal osteoporosis, no, everybody knows, is so common that it is to be addressed, and all the ladies, they should understand that how this can be combated by the exercise and physical activity. Physical exercise program improve the strength and balance in aging women with osteoporosis. Without any doubt, additionally, fragility fracture, fragility fracture means osteoporotic fractures. The risk associated with the osteoporosis can be decreased by following an exercise program. Exercise increases the bone density, this is a well-known fact, and reduces the inflammatory markers. Thus, having an active lifestyle from a very early stage and following recommendations for exercise could be beneficial for such movement. Furthermore, the exercise and mechanical loading, they also have a positive impact on the molecular level, cellular or the tissue level. Like with aging, the potential for cell proliferation and the number of stem progenitor-like cells decreases in tendons. The exercise loading can induce an increase in the tendon collagen synthesis, thus increasing the tendon strength. So the strength, muscular strength or the tendons, only they are the tapering ends of the muscles where the muscles attach on the bone. Physical exercise and mechanical loading also have a positive role in maintaining cartilage and bone. Most of the cartilages, they are at ends of the bone forming the joints, and it is pertinent they should remain healthy to avoid the arthritis. Also a positive role, for such good health of the cartilage and bone. Moderate exercise could also enhance the quality of tissue produced during the healing of injured tendons. Even post-traumatic conditions of the muscles and tendons, exercise, they benefit a lot to regain or maintain the health of the such injured tendons. Relationship between the obesity and the musculoskeletal diseases. Surge in the sedentary behavior and unhealthy diets have caused a global obesity epidemic along with a sharp rise in the incidence of the type 2 diabetes mellitus. There are further great risk factors for cardiovascular and neurodegenerative conditions which further give complications in the management of the musculoskeletal diseases. Now, lot of stress has been given to the obesity and its related problems. Obesity is an important comorbidity of many musculoskeletal conditions like the osteoarthritis or even in rheumatoid arthritis, and it is closely related to the development of such type of the arthritis that is the commonest musculoskeletal health issue. Thus, strategies aimed at reducing the obesity in adults will reduce the occurrence of the arthritis and thus can alleviate some of the pain of the individuals in such musculoskeletal conditions. Now, interestingly, the obesity is also one of the most modifiable risk factor in osteoarthritis. So, in the prevention and management of the osteoarthritis, the obesity is always being addressed that it should be reduced. And exercise weight loss have benefited overweight and obese adults with knee osteoarthritis. In many clinical trials, this has been proved positively. Thus, combining modest weight loss with moderate exercise can provide the best overall improvement in the symptoms of the pain and joint function. Now, coming to the what are the consequences of the childhood obesity and physical activity. Now, coming to the pediatric group, this is also very important for as regard the musculoskeletal health is concerned. Lack of physical exercise in childhood, this causes childhood obesity, which further leads to musculoskeletal pain in later life. Now we see a lot of children and adolescents with the problems related with the overweight and obesity. Thus, reducing obesity in children by encouraging physical activity will also reduce the risk of developing such musculoskeletal disorders. Furthermore, the consumption of unhealthy food and diet, such diet, and furthermore the sedentary lifestyle, that is the contributing to the increased incidence of the pediatric or childhood obesity. Low in nutritional value and high in caloric content foods, like the fast foods, rich in calories, they further contribute to the obesity epidemic, which may also play a role in the high prevalence of the type 2 diabetes and the further leading to the cardiovascular disease, which are further exacerbated by the lack of fitness and inactivity. So, to conclude the pediatric problems, the obesity, diabetes mellitus, and further leading to cardiovascular diseases may lead to musculoskeletal health also. Now, question is diet also a part of healthy living? How does it affect musculoskeletal health? So, a lot of things have been said regarding the diet and type of the food which one should consume to have a good musculoskeletal health. Yes, diet is inevitably an important part for the healthy living. A 3-year follow-up study including about 400 adults showed that diet high in potassium that is available in some fruits and the vegetables reduce the amount of muscle loss in adults, even those who are more than 65 years. So, dietary flavonoid intake from fruits and vegetables is also known to be positively correlated with the good bone health. So, two things have come: flavonoids intake and the diets rich in potassium. They lead to good bone mineral density and the bone resorption is reduced, particularly in perimenopausal or the postmenopausal women. Improving the diet of osteoarthritic patients have also shown great benefits. What type of the diet is recommendations? Vitamin D, very important, cholecalciferol, calcium-rich diet, and particularly the good protein consumption have been shown to optimize muscle, bone, and functional outcomes in older people, reducing fall and fractures. I mean ki fall and this may lead to osteoporotic fractures due to poor musculoskeletal health. This can be reduced by intake of all these things. Calcium, protein, synergistically optimize good bone health. Thus, dietary strategies for improving the musculoskeletal health should include consumption of long-chain fatty acids, vitamin D, and potassium that helps in the bone and cartilage mineralization and decreasing the blood cholesterol also. So lipid profile also improves with such diets, and there is ultimately leading to good effect on the cardiovascular health also. Antioxidant rich diet, they also benefit to the athletes by improving the tissue repair. Now, the sarcopenia in elderly people is another problem that can be benefited by combining the exercise with the dietary supplement of whey protein fortified with vitamin D, as it increases the muscle mass and the strength. So, to conclude, the poor musculoskeletal health conditions which are very prevalent nowadays, this can be improved first of all by good quality of life, good physical activity, exercising regularly, intake of the healthy and good diet that should be rich in the protein, that should be rich in the vitamin D, that should be rich in the potassium, and avoiding the fatty food, fast food, so such junk foods, this should be avoided. And in all conditions, inactivity and sedentary life, this should be always discouraged. One should always exercise to maintain the good musculoskeletal health. So I want to speak these words to all my populations, that is the pediatric age group, middle class age group, geriatric, that is older persons, and as well as perimenopausal and postmenopausal women. Thanks a lot. Thank you.